Good afternoon, ladies and gentlemen. According to Census.gov in 2018, the national poverty rate was 11.8%. A massive 38.1 million people in the United States without the proper funds to care for themselves. Therefore, I stand resolved. The United States should raise the federal minimum wage. First, we need to get into some definitions. First and foremost, minimum wage is defined as the lowest wage permitted by law or by a special agreement, such as one with a labor union. Source, Oxford Dictionary. The same source for poverty. First and foremost, the state of being extremely poor. Secondly, the state of being inferior in quality or insufficient in amount. And having stated these definitions, I propose contention 1. The federal minimum wage, being $7.25, is harmful. Our significance. The federal minimum wage is currently a poverty wage. According to the Economic Policy Institute, the annual wage income for a full-time federal minimum wage worker was $15,080 in 2017. However, current U.S. government poverty thresholds supplied by the U.S. Department of Health and Human Services state that one-person household is poor when their annual income is below $12,000. For a two-person home, the threshold is $17,000. B. Harms. Poverty can affect mental and physical health in both children and adults. According to the National Institute of Health of Canada, poverty in children can lead to being overweight or obese, increased physical injury, as well as negative birth effects such as asthma. Their data finds that 35% of 5 to 17-year-olds who lived in a neighborhood of lower socioeconomic status were considered overweight, while only 24% of children in neighborhoods of higher socioeconomic status were considered overweight. Their data finds that children who were 0 to 19 years in Manitoba's lowest income urban neighborhoods averaged 2.5 times higher risk of hospitalization for injuries than children in higher income urban neighborhoods. Finally, the low birth rate was 40% higher in Canada's lower income neighborhoods than in the highest income urban neighborhoods, leading to a higher infant mortality rate, as well as asthma. According to Joseph Rowntree Foundation, based in the UK, poverty in adults can lead to an increased rate of mental illness such as schizophrenia, depression, and anxiety, as well as decreased long-term health, with a scarcity mindset. The foundation states that poverty is a significant risk factor in mental illness, that it leads to something called the social drift hypothesis, which can lead to increased rates of a number of mental illnesses. The scarcity mindset is a hypothesis that states that people's attention focus narrows, concentrating on the immediate task at hand, mostly replenishing the limited resources, at the expense of peripheral tasks or long-term planning. It is a mindset that everyone experiences. However, children who experience this more often in their development years can experience it more prominently in adulthood. And finally, C, inherency. Our first one is structural. The federal designated minimum wage is $7.25. According to the U.S. Department of Labor, the federal minimum wage for covered non-exempt employees is $7.25 per hour. According to the National Conference of State Legislatures, 20 of 50 states maintain a state-ordained minimum wage of $7.25 or lower, while others range from $8.56 in Florida to $14 an hour in D.C. While some of these are significantly higher than others, if the federal minimum wage remains at $7.25, then the 20 remaining states that sit at $7.25, as well as the other higher minimum wage that do not reach the cost of living in their states, will remain unchecked and at these low wages. The structural inherency leads to the harms that I have previously outlined. Due to these problems, I offer my plan. Plank 1, agency, the United States Department of Labor. Plank 2, mandates. The United States Department of Labor must pass a mandate that orders the raising of minimum wage to $15 an hour by 2025. 1. The Department of Labor will be responsible for the implementation, regulation, and enforcement. 2. The minimum wage will be raised gradually by $1.10 every year, save for 2019 when it will be raised by $1.15, until it will finally rest at $15 an hour in 2025. 3. Overtime wages remain the same, with a 1.5 multiplier to all earnings after 40 hours of work. 4. The hours worked by an employee will remain in the hands of the employee-employer's agreement and will include all the time during an employee is required to be on the employer's premises on duty or at a prescribed workplace. The same as under the current FLSA. Employers will be required to display an official poster outlining this mandate, as well as keep employee times and pay records, the same as under the current FLSA. And finally, 6. Current child labor laws under the designation of the FLSA will remain the same. Plank 3. Enforcement. Any place of business found not following these new mandates will 1. Experience an investigation from the Department of Labor. 2. Payment of back owed pay. 3. The potential loss of a business license. 4. A fine that is equivalent to the size of the business as well as the impact of the offense. Plank 4. Funding and staffing. Funding and staffing will remain the same as it does under the current regulation of the FLSA. Places of business will pay their employer their required wage, and the Department of Labor will handle all complaints of wage, overtime pay, and vacation pay. Contention 2. When put into place, this plan will provide a more economically sound nation than the current wage. A. Workability. This plan will work because similar plans have worked in the other places. First and foremost, New York City's minimum wage grew to a $15 per hour gradually, the same as our federal plan. Looking at the restaurant industry shows a positive change. According to MarketWatch, prices have gone up in restaurants to combat labor costs. However, this has not affected the restaurant's overall guest counts or its overall sale rates. Secondly, Seattle is currently working through a similar plan. According to GROW, as well as the research from UC Berkeley, concluded that minimum wage policy achieved its goals in raising wages for low-wage workers while also not experiencing much impact in overall unemployment rate. B. Solvency. A $15 hour minimum wage would lead to an estimated annual $29,000 based on a 40-hour work week, 52 weeks of the year. That would bring the minimum wage workers up above the poverty threshold of an even 4-person household, an annual $26,000 a year, therefore reducing the poverty effects of children, such as physical injury, obesity, mental illness, as well as adults for the same thing. And finally, C, our advantages. According to the Committee on Education and the Workhouse, businesses will benefit from modest increase in minimum wage by increasing worker productivity, reducing employee turnover, as well as reducing absenteeism. Secondly, the same committee states that raising the minimum wage will boost the economy by increasing spending and creating positive job growth. Thank you very much, ladies and gentlemen. I rest my case.